Hello, Dr. Lewis here on the topic of chronic infection driving a significant portion of the chronic diseases we face as a society. And I believe it's much more prevalent than most people think about. Therefore, we've written a couple books, myself and Dr. Tremp and myself, Dr. Tremp at Harvard, uncovering chronic inflammation and hidden infections, the untold story behind chronic disease prevention and reversal, and Alzheimer's, the Brain and Beyond, where we talk in Chapter 9 about spirochetes and other infection exacerbating or even causing Alzheimer's disease. So these chronic infections are much more prevalent than we give credit to them for in chronic disease. For example, in a group of 100 I studied a couple of years ago, we did labs on 100. 42 of them we had suspicions based on white blood cell counts and some basic inflammatory markers, and 41 of them turned out to be positive for Lyme and a variety of other chronic infectious species. So a lot of people come to our program with unresolved health complaints. They've seen a lot of practitioners and done a lot of different things and are on management treatments and whatnot and still have significant problems. These people usually, when we test them, have chronic infection because it can run the gamut from chronic pain, rheumatoid arthritis, psoriasis, to Alzheimer's and dementia. So these infections can cause a wide range of different diseases. So here's sort of in a nutshell the why behind looking at infection in chronic diseases. And I believe there are really four mechanisms that drive all chronic diseases, and that's 80 to 90% of all disease states in our society, is low nutrient density. So our body doesn't have a chance to repair and recover from wear and tear. Sensitivities, which just drive inflammation and create leaky gut syndrome and have molecules cross into our bloodstream that are foreign to our body, and our body attacks it. And then we go into a thrive versus survive mode where we allocate resources to survival rather than thriving. And at this point, certain tissue can be left vulnerable to what? Chronic infections. So all of these three are potentially drivers for this fourth mechanism of chronic disease, chronic subacute infection. So you don't feel sick in a lot of cases with these organisms. You have symptoms that are called cryptic and ectopic. They're not necessarily tied back to the infection, but they're there and they're present. And people who are studying you don't really understand the why of it. So here's a good reference when you want to look at this from a broader sense. This is Dr. Paul Ewald, evolutionary biologist, wrote the book Plague Time, and a number of articles that show up in various publications that help explain how the uptick in a variety of chronic diseases from cancer to Alzheimer's are well explained through a new germ theory and not through, say, a lipid hypothesis or genomics, genetics, or things of that nature. So this is really important. And this is what Dr. Ewald says, that, we might be frightened by the fact that there's infection around. Look, we're all infected. When you die, you're no longer interacting with the environment, yet you start decomposing from within. Your immune system is zero. The infection was already there. So what it really tells you is your treatment for these infectious species is just a healthy immune system. But the point is, if we know what's causing debility, we can treat it. If we don't, then all we can do is treat symptoms, and that's what the medical system is doing today. So the other quote he says is, throughout history, most people have died of infectious disease. And the new germ theory says most people continue to die of infectious diseases. We're just not studying that well enough to understand it. And I encourage you to read this article from Ewald in The Atlantic, February 1999. It's a long time ago, but it still holds true today based on what we see. This is a very complex video explaining chlamydia pneumoniae and biofilms, which get into our body when we're vulnerable and cause and perpetuate disease. And here's the link, or you can go to healthrevivalpartners.com and look at our blog. And I have this as a video, 10-minute video for you to see. It's on YouTube as well. Here's a very prestigious lady, Gail Castle, who was a former vice president of scientific affairs and distinguished Lilly research scholar for infectious disease at Lilly. And what she says is there are infectious causes of chronic inflammatory diseases. Guess what? Those are all of them. Alzheimer's, diabetes, and vascular disease, and even cancer, but she calls out cancer as a separate category. It too is an inflammatory disease. We see white blood cells recruited to tumors. We see elevated white blood cells, or even sometimes suppressed white blood cells in cancer. And the types of things she's talking about: Helicobacter pylori, the Nobel Prize for stomach ulcers, but stomach cancer, acid reflux, Helicobacter pylori, mycoplasmas, walking pneumonia, blood clots, asthma, chlamydia pneumoniae, heart disease, stroke, things of that nature. So these are all articulated by Dr. Castle in her paper. So what are these things? They're called vectors. They get into our system through things that carry these diseases, mosquitoes, ticks, things of that nature. So the vector transportation, sometimes we can get transmission from individual to individual with mycoplasma pneumonia and chlamydia pneumoniae, where a simple cough will infect us. Are we doomed? No, if our immune system's healthy, then we can squash the pathogen before it takes hold. But if we don't do that, they can form systemic body-wide diseases, but more frequently they cause what are called focal or localized diseases. For example, periodontal disease is a focal disease of the gum caused by a spirochete. Spirochetes in the brain can cause Alzheimer's. So here's a list of all the types of vector infections that we can be thinking about, from Babesia related to Lyme, Borrelia burgdorferi, Lyme, but chlamydia pneumoniae and other infectious species that are rickettsial diseases that can cause a myriad of symptoms that we're being treated symptomatically for, but really have a fundamental causation related to these organisms. So here's a communication from a retired doctor from England, Dr. David Weldon. And what he says is that testing for something as simple as chlamydia pneumoniae is problematic in the UK. Few laboratories do it. But here's what he calls an incomplete list of things that he's seen related to positive testing for the chlamydia pneumonia infection. So cardiac conduction defects. I had that. I had atrial fibrillation from Lyme disease, and I treated it for 18 months and overcame it after getting an ablation. But I've never gone back into atrial fibrillation because I've treated the underlying cause. So encephalitis, a lot of eye diseases, Crohn's, a gut disease, schizophrenia, brain disease, COPD. Here's a lady where he's talking about you treating one condition, and there's a infectious etiology, so a high IgA titer for chlamydia pneumoniae, presumably in this case, and she was having a hard time swallowing. She could only drink liquids, and months later she was eating pizza, being treated for the chlamydia pneumoniae for chronic fatigue syndrome. So this is the breadth and depth of things that these organisms can cause, and they're treatable. So we can see that Dr. Weldon solved this person's problem of exacerbated by chlamydia pneumonia infection through proper treatment. Toxoplasma gondii, toxoplasmosis. The CDC talks about it, and they say pregnant women should stay away from toxoplasmosis through cat litter infection. Why? Because the pregnant woman is vulnerable, supporting two lives, and the fetus the brain is developing, and you don't want toxo infection in their system during that time. It'll retard neuronal growth, brain development. So these children will either be stillborn, premature birth, or come out mentally retarded potentially. So, but toxoplasmosis is gets inside the cells, parasite. And so it's not just pregnant women who are vulnerable, the young, the old, and people who suffer from any of the four mechanisms of disease we talk about. A co-infection like Lyme, poor diet, sensitivities, fight or flight mechanism, so thrive or survive. All these things make you vulnerable to something like toxoplasmosis getting into your system through cat feces, through raw meat. Things of that nature can expose you to these organisms. Here is Dr. Thomas Borody, the head of the Center for Digestive Diseases in Sydney, Australia, and he was involved with the Nobel Prize in Medicine awarded to Warren and Marshall. One of these two gentlemen infected themselves with Helicobacter pylori because the medical community did not believe their data on the association between Helicobacter infection and stomach ulcers. Now we know it's much more beyond stomach ulcers into stomach cancers. But Dr. Borody developed the triple antibiotic to treat and cure them from the h-pylori infection, and today he runs a robust program and is a worldwide consultant on fecal transplants, which help restore our microbiome when antibiotic treatment, and infection has wiped out the good flora in our gut. And here are a couple audio files, which I won't play right now, but basically Dr. Borody says that if you're worried about your heart and your vascular health, you will look for and treat organisms like chlamydia, chlamydophila pneumoniae as a target for endothelial dysfunction and vascular dysfunction, which leads to heart attack and stroke. We have a big problem in this country in that the major course of drugs being developed are so-called biologics. Now, biologics is an interesting title, but what they're really doing is biologically they're suppressing our immune system, tuning it down to overcome symptoms in certain areas. You'll hear on the advertisements, tell your doctor if you have an infection. That's backwards. The doctor should tell you if you have an infection, and you should never be on one of these drugs because long term, anything like tuberculosis, Hep C, Hep B, but chlamydia pneumoniae, Lyme, will be exacerbated, will be accelerated when you're on these drugs. You may see symptom relief over the first couple of years, but these infections in their chronic phase will begin to worsen over time as they exploit the fact that these drugs are tuning down your immune system and they're coming in opportunistically to proliferate and express. So one of the things you'll see with infection, if you treat it properly, is what's called a Jarisch-Herxheimer's reaction, which is a flu-like response. So here you are going along feeling fine. Yeah, you have Crohn's, or you have chronic fatigue, or you have something else going on that doctors don't really understand, but you get a microbial treatment, antibiotics or natural anti-infectives, and you feel lousy. That's because you're actually killing off bacteria that is actually probably contributing to that condition, and you'll release endotoxins that will then lead to the recruitment of inflammatory cytokines, which lead to the flu-like symptoms that you get when you have the flu. But it may be localized. It may not be true flu-like symptoms. You may just feel achiness. You may feel localized headache or mental fog. Any number of these things can manifest when you're properly treating a chronic infection. So this is the first of many videos we'll be presenting on chronic infection in chronic disease. The good thing is, if you have unresolved problems and you test and are positive for chronic infection, that may be your solution. Certainly you've probably heard in the case of Lyme and others, they're not easy to treat, but they're treatable, as opposed to being on a drug for life and having your condition slowly degrade insidiously as you get worse and as your immune system deteriorates as you age. But the point is, simple blood tests. A white blood cell count with differential gives us strong clues as to whether you have a chronic infection. We can test for the organisms. They're not that expensive, and their panels are readily available. So if you have unresolved problems, give consideration to looking at chronic infection as being behind these problems because they have solutions. I hope you found this information of value, and I look forward to you listening to future videos on this topic. Thank you very much for your time.